It's December the 9th, 1979, and after 4 days of discussions, a committee of eminent scientists finally agreed to certify the eradication from the planet of the deadly infectious disease smallpox. A few months later, a formal announcement will be made at the World Health Assembly. This is the moment Professor Donald A. Henderson has been waiting for. For over a decade, he's been leading a team charged with ridding the world of what was called the ancient scourge. But when the declaration comes, his feelings are mixed.
People thought I would be ecstatic. In fact, I was really quite sad because it suddenly occurred to me, I'm not going to be able to do this again. That is, getting out into the field, knowing the people, knowing the country.
Professor Henderson, an American physician and epidemiologist, is now 81 years old, but was still in his 30s when in 1966 he moved to Geneva to lead the team which would attempt to do something which had never been done before, to deliberately eliminate an infectious disease. At the time of his appointment, smallpox was still infecting around 10 to 15 million people worldwide annually, and killing around a quarter of those who caught it. There was no mistaking most of the victims, large bumps filled with a viscous, opaque fluid which shroud the body and face. Those who survived were often left scarred or blinded. But Professor Henderson's response to his new assignment was one of surprise and some reluctance.
Well, I was stunned. I was working at the Communicable Disease Center in Atlanta and had a very great many things to do. And all of a sudden I'm called to Washington and told, you are now assigned to head the World Health Organization smallpox program. I was not terribly happy about that because the amount of money that was available was small. You're trying to get countries around the world. You get all of them eventually to cooperate. And it was a pretty formidable task, but at any rate, I had to say yes.
Vast the task was, but the professor did at least think it was technically feasible. Vaccination programs had rid Europe and the United States of smallpox, and his team notched up some early successes in Africa. They then turned their attentions to the East.
What we were trying to do with trying to find cases and then to stop them by vaccinating around all their contacts and kind of isolating what we called a ring vaccination. And it seemed to work very well in Africa, but when it got to Asia, it just didn't seem to be going at all well. And we sat down, thought about it, and we thought, we really got to do something here. And finally we decided, well, if we could get to the cases earlier, we might be able to do it. And so we worked out a plan to visit every village in India in 10 days' time, and that would be health staff doing it, and then eventually every house in India. And in fact, we had 120,000 health workers working. And this began to make a big difference. We were finding many, many more cases, but we were stopping many, many more outbreaks. And that was a pretty memorable moment when we thought, we finally have gotten to the most difficult country, and I think we've got the answer.
But then, just as they finally felt they were making an impact, events appeared to conspire against them.
All of a sudden, a number of things happened. There was the gas crisis in the Middle East, and suddenly we could not get gasoline for the vehicles. On top of that, the trains went on strike. Then the airlines went on strike. Some of our health workers started to go on strike. And then the worst floods in something like 30 years hit the worst areas, the most affected areas. We had refugees in the hundreds of thousands. And it just looked like everything was falling apart. And then India detonated a nuclear weapon. And that was May of 1974. It seemed like nothing else could happen at that point. But what did happen was there was a lot of international press there covering it. And headlines were out all around the world about India having detonated this bomb, but at the same time recording more cases of smallpox than they recorded in 20 years. Well, that was because we were finding the cases and reporting them. And with that, Prime Minister Gandhi took a much, much more interest in the program. We got more resources, and then things began to get much, much better. And within a year, we had our last case.
Then there was the chance discovery made by Professor Henderson in a US laboratory. Smallpox vaccine had up until then been delivered by lancing the skin, so that a drop of the vaccine could be absorbed into the body. But the approach was only 60 to 70% effective. The professor was visiting a laboratory in Pennsylvania when he came across a two-pronged needle which he thought might deliver better results. He made a few changes to the design, and the effects were startling. The vaccine now appeared 100% effective, and the needles came cheap.
We had to pay $5 a thousand for them. We could reuse them many, many times. You just put them in a bucket of water, boil them. They're ready for the next day. You could teach vaccinators within 15 minutes to do vaccination, and they would be ultimately successful. And the amazing thing was also that our vials of vaccine, which contained just 25 doses, now contained 100 doses. We get 100 vaccinations out of a single vial with this needle. So all of a sudden, vaccine, which was in short supply, suddenly became ample supply because it was multiplied 4 times just by this silly little needle.
Despite the new needle, there then followed a long series of false dawns, with officials thinking smallpox was gone, only for their hopes to be dashed.
Well, we had, I think, 4 different occasions when it was thought that we'd had the last cases of smallpox, and one of them was in Nigeria, which is a very large country, and they'd had the last case of smallpox. They'd waited fully 6 weeks. They'd been searching for cases. There was nothing there, and so they decided to put on a big feast. And it was in the middle of the feast they got a message that there was smallpox up in another village way up to the north. And so they headed north, and there were cases. And that happened again. It happened in Indonesia, and it happened again in Ethiopia. And so when we came to what we thought was the last case in a country, I think everybody sort of held their breath.
Then in 1977 came news of another case back in Africa, in Somalia.
I was apprehensive. It just seemed like again and again we thought we were gotten rid of it in the country, and we were foiled. And here we were thinking that we had seen the last case of smallpox in the world. It was quite unbelievable as we thought about it. But sure enough, it turned out this one case, a 26-year-old cook, had developed smallpox on 26th of October, 1977. And that turned out to be the last case of smallpox.
The hospital cook was called Ali Malin. He was thought to have contracted the disease while helping with the eradication program, bringing in 2 children from an outlying village who had smallpox symptoms. He made a full recovery. 3 years later came the formal announcement in Geneva, an event which for the professor signalled the end of an adventure of a lifetime.